For this tutorial, we're working on the carpus in the large animals, and we'll be working on equine and bovine carpus. So first of all, we'll look at this standing limb. So we have the distal limb here of an equine, and this is a left forelimb. So we'll look at this area, which is the carpal bones, and we'll zoom in and take a look at the two different rows of carpal bones. So here you can see the distal part of the radius and how that articulates with this first row, the proximal row of carpal bones here. So the proximal row of carpal bones are associated with names. So those have names. The distal row of carpal bones here all have numbers. So names here, numbers are here, and then you're articulating with the cannon bone here. So this is the area of the carpus that we're looking at. First, we'll start with the proximal row here. So here in the equine, you should typically have always have four bones in this row. So on the medial side, you'll have the radial carpal bone here. In the middle, you'll have this intermediate carpal bone there. On the lateral side, you'll have the ulnar carpal bone. And then here around the back side, which we'll take a look at in a little while, is the accessory carpal bone, and that's on the lateral side. So here on the distal row of bones, now these have numbers, and so this is where the numbers can be a little bit different, because in about 15 to 20% of equines you will have a C1, but the majority of equines will not have a C1. So that's going to be back here where you can't see right now, but we'll take a look at that in a little bit. And C2 here is on the medial side. So C2, C3, and then C4 is going to be over here. So now we'll take a closer look at a carpus of the equine. So here's a closer view of an isolated equine carpus. So I don't have it on the standing limb anymore. This is just the carpal area. So here you have the distal part of the radius. Here we have the cannon bone. And we're looking at these two rows of carpal bones here. So this is a cranial view. And now I'm going to turn it to a slightly medial view. So turning to the medial side, here, the first row of carpal bones, the proximal row, you're on the medial side, so you have the radial carpal bone right here. So then we'll turn it to the cranial view, and in between your radial and ulnar, you have this intermediate, so in between, intermediate carpal bone. Then turning it to the medial side, so a lateral side, the lateral view, you'll have this ulnar carpal bone here. So ulnar is on the lateral side. And then we'll see the accessory carpal bone, which is a very distinctive looking bone right here on the lateral side, and actually creates the lateral wall of the carpal canal in the specimen. So here is the accessory carpal bone, ulnar carpal bone. On the cranial view, you have intermediate carpal bone, and then radial carpal bone on the medial side. So now we'll move down to the distal row of carpal bones. And so those have numbers rather than names. So this specimen is a typical equine specimen and does not have a C1. So here we're looking at kind of a caudal view, and you don't see a C1, which would be sitting right here, but it does not have one, which is average, and most ponies or most horses will not have one. And so you have C2 is the starting number in this distal row. So C2 is here. Then we move cranially. We have C3 is this big one in the middle. And then if you move laterally, you have C4 there. So now I just want to show you this really big draft horse carpus. So this is a big horse, and it has a C1. So here we're on the cranial view. You can see it's quite a bit bigger than the other one I just showed you. But here I'm going to turn it to the medial side, and then we're going to move caudally. And so here, you can actually see in this distal row, so distal row of carpal bones is here, you have this little seed-like bone almost. So it's not a sesamoid, but it is C1. So C1 right here, and it's present in about 15 to 20% of radiographic images on the carpus. So C1, and then C2 is here, and then you continue numbering just the same as you would in a regular carpus specimen. But just to note that some have C1 and some do not.